Thank you so much, Lisa. Good afternoon, everyone, and welcome to the second annual NorCal Symposium on Climate, Health, and Equity. My name is Dr. Aude Boignon, and I'm a neuroscientist and medical student passionate about applying cutting-edge science to the most complex health and social problems of our time. Early in my medical training, I learned about the toxic history at Baby Hunters Point, a San Francisco community plagued by nuclear radioactive waste since World War II. I committed to using my time and energy to elevate this community's struggle for health and justice and work to expand health access to those most burdened by environmental exposures and legacies of racism.
My name is India Rogers-Shep, and I am a medical student at Stanford. When I was 2 years old, I was a healthy toddler. However, after my family moved to a country where plastics are regularly burned, I developed asthma. This chronic disease makes me emblematic of statistics that plague the Black community, communities which live in poverty, and global communities that face undue pollution burdens. So the issue of environmental justice is personal to me.
My name is Vivian Vee, and I'm a junior specialist here at UC Davis researching lung inflammation. Having grown up in a low-income neighborhood myself, I recognize how communities like my own have been most impacted by systemic oppression. Within my work, I have met many individuals and learned the realities of living in medically underserved areas. I understand how inaccessibility to medical providers and the feeling of isolation compound their existing inequalities. Through our discussion today, we hope that you will leave as active participants in changing our healthcare system to empower people, especially impoverished families, to prioritize their health. Climate change is the greatest, most existential threat facing current and future generations. Our panel discussion today will be centered around 3 different institutions: UC Davis, UCSF, and Stanford, and the steps they have each taken to reduce their environmental impact, improve health equity, and enhance emergency preparedness. The pandemic has exposed the deep inequality and injustice within our society and healthcare structures. These inequalities are not accidental, but due to exploitative processes that benefited privileged members of our communities. We know the consequences of the climate crisis fall disproportionately on communities that are least equipped with the tools to protect themselves. We therefore must uproot these systemic practices that perpetuate inequity. Without our concerted and committed action, these communities will continue to face a greater burden of conflict, food insecurity, and mistrust towards healthcare institutions.
Oftentimes when we talk about the future, it is as if it revolved around a few. But it is not simply my future, nor does it only belong to my generation. We all have a part to play, and it will affect all of our communities. Our future, and not the distant future, but the one that begins with steps we take today, should be one that has trees and plants giving oxygen and shade to all communities. Because how can we expect them to thrive when we force them to grow in a harsh, blighted landscape? It should be one that nourishes us with accessible fresh air, clean water, and fresh local foods, along with plentiful community gardens. Folks should be able to live in mixed income, affordable housing with proper weatherization, electric stoves, and easily be able to work or see friends on an expanded electrified public transportation system. This future will be built upon research partnerships between communities and academic institutions that center and empower communities, similarly to the work Margaret Gordon is doing. To understand what our role in this future is, we ask that you listen with an open heart and mind. Our purpose is to emphasize the importance of equitable action on climate change. The desired outcomes hinge on our cooperation and partnerships with existing communities. We, as students, healthcare professionals, and community members, commit to improving the health of our communities and the planet. Only through a unified effort will we be able to transform our practices and policies to one that champions equity and environmental stewardship. To get us started, we'd like to introduce our speakers and thank them for their support of our symposium and joining us. Here with us today is David N Whissel, the CEO and President of Stanford Healthcare. He joined SHC in July 2016 with extensive executive experience at leading academic medical centers. He is a passionate advocate of precision health and focusing on prevention to empower patients to take charge of their health before they become ill. Next, we have Dr. David Lubarsky, the Vice Chancellor of Human Health Sciences and CEO of UC Davis Health. Since joining UC Davis Health in 2018, Dr. Lubarsky has recommitted the organization to expanding care for the underserved through reforming the managed care system and improving access to primary and specialty care.
Next, I'd like to welcome Dr. Doris Brown. She is the president and CEO of Brown & Associates, LLC, a health consulting company that manages programs addressing national and global health disparities. As the 118th president of the National Medical Association, She focuses her program on a collaborative approach to health equity entitled The Urgency of Now, Creating a Culture for Health Equity. Representing UCSF, we have Dr. Sam Hagood, a renowned researcher, professor, academic leader, and pediatrician who has served as chancellor since 2014. Today, Hagood, the Arthur and Tony Rembe Rock Distinguished Professor at UCSF, oversees the $1 million UCSF enterprise, which includes the top public recipient of research funds from the NIH, a nationally ranked medical center, and San Francisco's second largest employer of more than 30,000 faculty and staff. Our moderator for today's panel will be Dr. Teresa Maldonado. Dr. Maldonado was appointed as the Vice President for Research and Innovation at the University of California in March 2020. Prior to this, she served as a Dean and Ritter Professor of Engineering at the University of Texas in El Paso. Dr. Maldonado shares with us many years of experience working at the federal level to advance engineering research, education, and commercialization initiatives. I want to thank each of our panelists for taking the time to be here today and for sharing your thoughts on these critical issues. You'd be hard pressed to find a room with more collective brainpower, health system expertise, and care than the one we're in now. For this panel, we'll begin with a roundtable discussion with pre-selected questions that will be moderated by Dr. Maldonado. Followed by this, we will have a Q&A from the audience. Please put your questions in the chat box and we'll get to as many of them as we can by the end of the session. We'll finish with closing remarks from Dr. Angela Hoxu. Dr. Maldonado, I'll hand the mic off to you to start a discussion.
Dr. Maldonado,
Yes, I have it. Yes. I don't do that often. Thank you, students. Thank you so much for your very wise remarks. They are so spot on. And for taking a significant role in organizing this important event on climate change, health, and equity. We may be at a critical moment in time as we are witnessing what may be real tipping points in our climate and the health of our Earth systems. I am pleased to be moderating this panel of special guests, so let's begin. The first question I'd like to direct to David Entwistle. Let's see, where are you on the screen? There you are. What has changed for you since the symposium held last year?
I think about that question. That is a loaded question. If you think about all of our lives over the last year, 18 months, or even 2 years, but happy to be on. Let me just, first of all, I'm so honored to be on such a distinguished panel of guests, I will say. Some amazing individuals on here, and happy to be part of that. And thank you, Dr. Maldonado, for your time today. If I look at what is fundamentally one of the things that we've looked at in this last year, and certainly there was an awareness of this, but we recognize the immediate and imminent threats that really climate change cause on health. That is something I think and I hope that we all walk away with knowing this is something that actually needs action. And I'll say that we've taken some action at our organization. And I want to just touch on 3 things real quick that I think has been something that, as you think about that, what has been prompted by and caused us to think about in this last year. First off, we have a great partnership with our campus, and we have a sustainable Stanford program that's on campus. It's part of our land, building, and real estate group, which manages the central energy facility on campus. And one of the things that we've looked at specifically is how do we develop a stronger relationship around sustainable leadership in energy conservation. And so we've focused on what we actually look at, not only energy, but sustainable procurement. What is it that we're buying, building? Our construction guidelines, even looking at our energy and waste management across the campus. And that certainly is something over this last year with that common goal of having what can we do to create a more sustainable environment. We've also looked at, on the research front, we have a new research committee that actually reviews both faculty and student proposals for research projects relating to sustainability, aiming specifically of how do we connect the academic research opportunities with really practical healthcare applications? How do we make sure that what we're doing can actually be applied? The research committee actually has had collaborative partnerships that have already come about. And in fact, one of the things that's been a great part about that is actually an assessment of a new building that we're actually going to be building in Redwood City as to how will that be sustainable over time. In fact, huge shout out and thank you for the Sean Parker Center actually for supporting this evaluation that we've done, actually to look at the mechanical systems of the new building to say, what would be better? Would it be all natural gas, all electric power, or actually a combination of the both? What would create the best design for, in fact, a sustainable building? Because as you know, some of these buildings could be around 30, 40, 50 plus years. And so we were pleased to do that. And I actually want to thank on our own campus, Dr. Carrie Nadeau for leading this initiative. And then the last piece just to touch on is in this last year, what have we been thinking about and doing? We actually conducted a new study on our greenhouse gases, which actually looked at our 2019 and 2020. We've done similar inventories in the past, but what we didn't do is isolate for what Stanford Healthcare has done. So we've actually, if you look at our children's hospital, you look at our main campus, and even our Hoover buildings, what can we do to actually look at a little bit differently? And that's actually allowed us to actually segregate and start to set specific goals for our organization. So again, great question. A lot of things that are in action, but what I love and I hope we all came away with is we were prompted to even further action as a result of last year's symposium.
Great, thank you so much. Anyone else would like to respond just in the last 12 months? A lot of discussion in the media about wildfire and climate. Do these stories, do situations you see locally and nationally help change the way you do business in a health institution?
Teresa, let me just build on what David said, because I think the challenges are different on the campus and the health system. Health systems or hospitals are notorious users of energy and water. Yet there are definitely things that we can do and have done. We've fairly dramatically reduced our water usage in the hospital and are moving more and more to the electric rather than generating our own power. So there are things that can be done, but hospitals, I think, have a particular challenge and need to really begin to think out of the box about some novel ways of reducing our energy consumption.
I just want to reiterate that, Sam.
I think we lost him.
Yeah.
His image is still there, and we'll give him an opportunity to come in. Is he coming in? His rectangle is lit.
I have to say, I'm getting signals at my
Sorry about that. My Zoom. It's been a difficult day today. Can you hear me now?
Yes.
Okay.
We sure
So,
can.
what Sam and David are saying, which is that healthcare is a tremendous contributor to greenhouse gases and climate change. If you take healthcare writ large across the globe, it's 4.4% of all greenhouse gas emissions. It would be the 5th largest country in the world if healthcare were taken by itself. In the United States, approximately 10% of greenhouse gases are emitted by healthcare. And that goes because of our, as we've said, not only water and energy consumption, of course, but there are a lot of things that we do such as waste of food that go to landfills, which then in turn become methane generators. And then our operating rooms, which are tremendously bad. Nitrous oxide being, I think, 400 times as bad as CO2 in terms of global warming, and halogenated hydrocarbons being really, really bad, with desflurane being the worst. I'm an anesthesiologist by training, and so there's a lot that we can do to reduce those emissions that we really have not addressed from a climate perspective and equity perspective in the past. And one of the things that we're doing, I think that's kind of unique, is we've identified that we throw out about 30% of our hospital meals because people are either tired, sleeping, visiting with family, down at radiology. And so we're instituting within the next year a full room service approach to food service, where people will be able to order what they want, when they want it delivered, and it will actually cost us less money and reduce our waste to almost zero in terms, because people will get the food they want at the time they want to eat it. Seems simple, But the idea of giving room service in a hospital, had you said that to me 10 years ago, I would have looked at you like you were crazy. And now I look at you like you're really, really smart. When my executive chef came to me with that idea.
And
So I
just
think
to
we're changing
add
our
to,
attitudes about what's worth looking into.
yes, I'm happy to see that you said that you're an anesthesiologist, because that is one of the areas in hospitals that really emit a large amount of the greenhouse gases. And as part of the National Medical Association, we have just put in a resolution to have our hospitals and where our doctors are working to look at greenhouse gas emissions from operating room, particularly from the anesthetic gases, and to come up with some solutions of reducing that. And there are some ways that you can reduce those gases. So glad to see that. I don't have to mention that as part of what we're doing in the association.
Well, I'd like to expand upon that in just a second. I have a particular question I'd like to ask you, Dr. Brown, but maybe we can discuss later that, you know, maybe our Bay Area hospitals and medical centers could, you know, standardize report cards, kind of greenhouse gas emission report cards. So I don't know, maybe there are standards out there, but it would be interesting to learn about those. Dr. Brown, what commitments should institutions make in the year ahead in terms of climate justice?
Thank you. Well, I should say thanks also for inviting me to be a part of this wonderful panel to talk about climate change and the progress that we have made over the last few years. We really know that climate change is probably the greatest public health challenge that we are going to face in this century. And it's threatening to undo a lot of good that we've made over the past decades. And so as a physician, we have a moral obligation to take action on climate change and to build the sustainable future for our children and our grandchildren. And when we look at institutions, and we just spoke about the significant role that health institutions, whether it's hospitals, medical schools, et cetera, for advancing climate justice. And I believe that part of that is through education and awareness. And so we have to take action to minimize some of the consequences of this environmental injustice that we have. It is just too much for us to ignore it at this point. I mean, you have the wildfires in California, and we have the flooding and the tornadoes and earthquakes and hurricanes here on the East Coast. And so it is our responsibility, I believe, to advocate for policies that's going to reduce the carbon pollution that's driving climate change. We have to educate and empower the next generation of health practitioners. And it's so wonderful to see our students engaged because we didn't really talk about climate issues as part of medical school during my training. We had a little bit of that in the School of Public Health that I was a part of, but we need to look at building that generation of health practitioners that really are going to bring about action that's going to change the climate that we know of now and into the future.
And if I could just add, you triggered a couple of thoughts. One is education awareness. A lot of people don't understand what we mean by climate justice, so that awareness, would be important. And you also suggested local context. You know, we have wildfires here, hurricanes on the East Coast. So talking about these issues in a local context is also important. So thank you very much. Dr. Lubarsky, let me direct this question to you, and it has a couple of parts. What plans do you have to achieve net zero emissions within your health system? And let me go ahead and mention the part A, part B, and I will be happy to repeat them. What is one major success your institution has had in becoming more sustainable? And what factors contributed to that success?
Right. Well, thank you for the question. So I would say that, we're fully committed to this. The University of California overall has set a carbon reduction policy in place for all of us. But I'm proud to say that my parent institution, the University of California, Davis, was ranked the #1 green university in the world. And UC Davis Health received the highest award from Green Practice, which rates health systems for how they're doing. And we achieved their highest level of award and certification this year. And it isn't for doing one thing, but really for doing many, many things. There's basically 11 things that Practice Green Health looks at: waste, chemicals, greening of the OR, food, sustainable procurement, energy utilization, water, climate, transportation, and green building. And I'll just touch on a couple of those. We had a goal to reduce our waste by 2%. We reduced it by 14%, or 182,000 pounds. In terms of, we talked about our food program. In terms of water, we replaced a lot of our water facilities. We'll save 10 million gallons a year this year. Every single building that we're doing is already net zero. And we were one of the very first health systems in the world to join the UN's net zero 2050 approach. And we are well on our way to being able to achieve that, and already at our 1990 emission levels and really pushing to get down farther. So, we opened up 3 new clinics that were LEED Gold, 2 office buildings that are LEED Platinum, and we're building a 1 million square foot hospital that will be net zero when it goes up. So, yeah, we're doing, literally, I've got teams working on this. If I did anything less, I wouldn't be able to show my face around the house. My daughter, who just graduated from engineering at UPenn, in material science engineering, her senior project was around recycling and wrote a program around how to figure out what's recyclable in your county. And if I'm not doing my part, I get an earful, right? And I want to applaud all the young people here who care so deeply, because you are moving us to be better leaders. You are moving us to really put this at the top of our agenda. We always have competing demands, but really, what's more important than the next generation or the next 2 generations? So thank you.
Great comments. Thank you. Dr. Hagood, there you are. How are your institutions advancing climate education among your students, clinicians, staff, and among those you serve?
Thanks for that question, Teresa, and thanks to the student organizers of this panel. As David said, the next generation is going to have to suffer the consequences of what we either do or don't do over the next few years. I think it's generally true today that most health professionals receive little to no training on the health and health equity impacts of climate change, or how they, as the next generation of health professionals, can respond to climate threats, both in their own clinics and in their own work in the community. We desperately need to prepare our entire healthcare workforce to confront the huge health challenge that climate change is going to bring to us in the 21st century. So I would say specifically, and the way we're thinking about this at UCSF, and I know others on this panel are thinking in the same way, we need to envision future health professionals who can, number 1, understand the links between climate, health, and equity. Number 2, address climate impacts with their patients and in their research. Number 3, effectively incorporate change and sustainability issues into their teaching. And 4th, constructively engage with communities and policymakers to advance climate solutions. Let me just give you a few very specific examples of how we're trying to translate those 4 aims into our curriculum at UCSF. So the first is we have created a UCSF-led UC-wide Center on Climate, Health, and Equity, and have completed the Climate and Health Integration Initiative with the goal to move the effects of climate and health into the curricula of all of our students. We've trained 11 faculty leads, who in turn have trained about 102 faculty across the UC system in the curricular impacts of climate change and sustainability. Another example is that last year, our Office of Sustainability supported a cross-campus campaign on climate justice. Our healthcare system and our affiliates onto 13 online events, which reached close to about 10,000 attendees. And this year, the campaign is focused on the people of sustainability, highlighting people across UCSF, faculty, staff, and students who are taking action on climate and other areas of sustainability. And perhaps the last example I will give amongst many that I won't mention is this past spring, our Center for Climate Health and Equity and our Office of Population Health and Health Equity co-hosted a spring speaker series with a session that brought together some of California's leading environmental justice groups for a conversation amongst all of our students about the building movement for climate, racial, and health justice. So we have a lot more to do, but I think we are starting within UCSF, within the UC system. I know at Stanford they have similar initiatives underway. So I think we'll see a vast increase on the literacy in this space amongst our students over the next few years.
Yeah, great. Would you like to respond, David? Entwistle?
Yeah. No, I thank Sam. And again, a lot of those initiatives, what you see as he shared, are things that are across our organization continue to just burgeon and grow. And I look forward to some of those partnerships actually and some of the things that we're working on and doing. But yeah, no, continued good thoughts about some of the things that are going on.
Thank you. Dr. Brown, any comments about advancing climate education from your perspective?
Yes, again, from the National Medical Association, we have been working really with other major health institutions. We are a member of a group called the Medical Society Consortium on Climate and Health. And through that organization, we have really been working to educate our professionals on the linkage. And I was glad that Dr. Hagood mentioned, because they're not aware of the links between climate and health. And we're really trying to educate them on that linkage and look at also some solutions to various things. So it's when we speak about topics in climate and health, and it's not just to speak about it, but you want to educate them to take the opportunity to act on it or to advocate. And we are looking at developing what we will call environmental ambassadors that's going to advocate for those priorities in the community. One of the things that we have done is get clinicians for healthcare, and we've started this in our state affiliates. And so it's just starting in the southern area with clinicians for climate and health. And so Florida, although I think we did reach out to Wisconsin, but really very advocate to talk about the priorities there, but also how to speak to their patients and get them to understand the small changes that they might be able to make to improve our climate. And so, yeah, those are the areas that we are involved in. We support and sign on to letters that are going to our congressional delegates to make sure that policies are enforced, and certainly really wanting to push this administration's better buyback, better budget act that is there to help us to get the infrastructure that is needed.
Excellent work, thank you. Dr. Entwistle, how do you envision major academic medical centers in Northern California working together on this urgent health threat in terms of research, community engagement, and sustained commitment?
Well, let me, oh, sorry. Make sure I have my mute off. First of all, let me just say, think about who you've got on the line today. I mean, I love to see our panel across, you've got some significant leaders in the industry coming together to talk about something that's so important. And I will say that is, in many cases, the first challenging part to be able to do that. And so our ability is to sustain that teamwork, that ability to come together, that ability to think through these solutions is going to be the power of, I think, what we do and what we bring together. We will always be better together. We will accomplish more in bringing these ideas to the table. And so I appreciate that actually this symposium is actually doing that. I think it's charging just those very ideas. So as we think about some of the things, again, specifically that we're looking at and doing, there was a collaboration and visioning session that was held last summer. And part of the energy that came out of that workshop, quite frankly, was we heard several peer organizations express interest in how could we come together to further think about decarbonization of healthcare. Think about that ability just through bringing the ideas to the forefront, seeing people getting excited about it. And that's something we're actually seeing, that being able to bring out and be a resource to bring some of those people together, I think will precipitate and bring a lot of those ideas to the table. I also see that there's some optimism in areas where, and I think, Sam, you were the one that mentioned this earlier, some of the areas that we think about in our own environment, and certainly David, some of the things you think about in the OR, the need for the humidification in our spaces, and even the need for some of the sterilization of our equipment, really are some of the richest sources of areas for us in creating carbons. And so how do we think about being creative? How do we incentivize creative ideas? And I can tell you, one of the opportunities that we had, in fact, in anesthesia, was the use of the choice of different anesthesia agents. In fact, part of the perspective that we were looking at the time were actually cost. But I have to tell you, what got actually folks rallying around changing which one they actually went to wasn't the cost, it was what was the impact that it had on our environment. And so to see that kind of energy and enthusiasm around multiple different initiatives certainly goes a long way, and I think brings part of that energy to that. I'm also proud our sustainability office is really capitalizing on this spark to look at how do we bring together this energy summit here in NorCal and even SoCal. Sorry to use the acronyms there, but how do we bring together some of these pieces and issues together? And I hope over time that energy of coming together, being at the table, generating ideas, and hopefully just feeding off that energy, which I think sometimes gets all of us excited about some of the things that we can do together. We can continue to precipitate that, and things like this symposium, I think, create that energy for us.
Great, thank you so much.
Teresa, I would just add that, a lot of the energy that David referred to around action on climate change and health has been from the ground up, particularly from our students who have been very active in pushing us. I think what's happened that feels different in the last couple of years is the accountability that is coming down. Certainly, President Drake, when he came into office about a year ago in the UC system, and he just gave his sort of State of the University address to the regents at their retreat a week or two ago, a big part of his speech was around climate change and really challenging all 10 campuses to bring their intellectual powerhouse to address climate change. The chair of the Board of Regents did the same thing. So I think as we as campus leaders or health system CEOs start to feel that accountability from the leaders above us, we'll merge that grassroots energy with knowing that we're being measured by how effective we are in these areas, and therefore we'll take concrete steps, is where I hope we'll see a real acceleration in advances here.
Well, that's great to hear. I know Chair Estelano, I've heard her at the Regents, but I didn't hear President Drake. Thank you, Sam. Thank you. Doris.
Yes, just wanting to add two things. One is really proud to know that obviously climate and health is catching on, because this administration has created the Office of Climate and Health in HHS, and they have just released the RFI on identifying 6 priority areas on research on human health and climate change, with an emphasis again on the inclusion of vulnerable populations in those priority areas. The second part of that is the National Academy of Science, Engineering, and Medicine on next week is holding the second part of its decarbonization panel, and it's a very diverse panel across all segments. I'm a part of that, and I don't know which one of the sections that I'm on, but that is again showing that there's a real impetus to address climate changes and its impact on health.
Great, thank you. I'll look that up on the web.
Yes.
I'm going to ask one more question of Dr. Lubarsky, and then I'm going to go to the questions from the audience that are really starting to come in. You've mentioned some of your successes at Davis. Can you tell us more about sustainability and equitable food systems? And you're on mute.
There we go. Okay. You'd think that by now we'd get that. Right? I know.
It's Friday. It's Friday.
It is Friday. This is like my 9th Zoom call today. So yeah, I think that there's a lot going on. Our executive chef, Santana Diaz, who used to actually work for a sports team, and he decided he wanted to do something that was more meaningful, just as we all want to do something more meaningful. And he came to work for us and has revolutionized how we think about food. You know, we were getting a bunch of food trucked in, you know, tomatoes from Missouri and, you know, and corn from Iowa. And we don't really need to do that, right? Because we have farms all over Northern California. And so we've converted 80% of our fresh foodstuffs to locally grown, number one. We won't take more than 50% of a farm's produce because we want to make sure they're not solely dependent on UC. All right, we don't want to be the bad overlord. We just want to be a good customer. We have worked with them on packaging to reduce packaging by 50% in order to reduce waste when it comes to us. We don't need all that packaging. We have plenty of refrigerators. It's not sitting on warehouse shelves. It comes to our hospital and it gets served, right? So we have worked with all of our local farms to change how they're doing that. And we are really working on trying to get to a 100% organic. Again, it's really easy to do organic when everything is literally, it is literally farm to fork. And we are the only hospital ever in the world to receive a Culinary James Beard Award 2 years running for Smart Catch Leader for institutional fresh food, especially regarding the seafood and doing it the right way. And as I'm sure all of you on here are, you know, like good restaurants. James Beard Awards are the, you know, other than a Michelin star, they really show that, you know, that's, you guys serving up good stuff. And I'm just very proud because we're bringing choice, and we're bringing excellent taste, and we're bringing some joy to the life of our patients and our staff by serving fresher, better food. And Alice Waters, coming up from your area, from Chez Panisse, is opening up her edible education program in Sacramento, in our inner city area where we're located, in order to create a sustainable change in diet and nutrition in the generation that's even younger than the ones who have organized this panel. So from K through 12. So we're very excited, literally the entire pipeline from farm to fork, from little children to culinary experts. We're trying to touch everyone with sustainable food procurement and utilization. And I already talked about how we're introducing room service and going to totally reduce waste in that regard.
Oh, that's superb. Thank you. Thank you very much. I'm going to pivot to the questions from the audience. So I'll just, state the question, and then we can have a discussion. A theme of this symposium this year is centering the voices of frontline and environmental justice communities that are most impacted by climate injustices. How will you pass the mic to these communities, partnering and co-designing with them to ensure they're prioritized for a livable future?
Well, I'll take a crack and perhaps answer it in general terms, meaning take that question and blow it up beyond climate change. You know, we all run very big organizations. Often we're the largest employer with the biggest real estate impact in the communities that we serve. That's certainly true for us in San Francisco. And I think there's a growing national awareness that that impact comes along with the social responsibility to be a powerful ally with others in the community. There's a formal movement that is most prominent with institutions of higher education and healthcare institutions called the Anchor Institution, where by committing to being an anchor institution, you are committing to working with the community in many ways. And as we've started that journey at UCSF, the critical importance of meaningful, truly respectful community partnerships has become very clear, whether it's in local hire, local procurement, working on issues of homelessness, mental health in the community. We cannot impose our will or impose our learnings on the community. It has to be a truly joint.
Did he freeze?
Front and center. We have to bring the community in. We have to learn from the community. What can we do that will be most impactful? So I think, again, I've noticed definitely across the nation, this sense of accountability to our communities. And
Is he frozen?
role of partnerships, partnering with the community, partnering with our departments of public health. And I hope some of those lessons from the pandemic spill over into the other areas where we can be equally impactful.
Excellent.
Maybe that, oh, sorry, go ahead, Doris.
Oh, well, just to add to that, it's certainly important in terms of partnering and engaging the community at the outset. But I think we have to find out what it is and what is important from the community, making sure that they are an active and equal partner in designing and coming up with programs that's going to move forward, rather than, for, as many times, organizations come to those communities and tell them what they're going to do without asking them what their needs are. And therefore, we don't have any changes. And you look at many of the things that you've mentioned in terms of the determinants of health are still there because we want to bring what we want, of what we perceive as their needs rather than their actual needs. And I think it's important in your partnership to be innovative in looking at groups that may not at first come to mind. AARP, the pharmaceutical industry, of course, but you look at them from another standpoint. But I'm thinking that they really want to look at the educational program to go down to our primary and secondary schools and educating our children to have that connection. And it's so good to see the young people here as the initiators of this program. But we can have ambassadors from all levels that's going to work, even getting some of the communities, whether your barbershops and your beauty shops and those places, to also be ambassadors to bring about changes.
Doris, I love that comment. And Sam, I'm glad that you brought in the community aspect of that and what we can do to have an impact. And I, like you, I think irregardless of what that issue is, we've got to engage the local community leaders. We have to go, as you said, it's the pastors, it's the community leaders, it's the churches, it's the community centers that will be where we'll be able to have that impact. But we do have to ask what are they willing to engage on? I mean, I think just most recently, and I'll draw the corollary with COVID and vaccines, what were we able to do to put into those communities that do have health inequities? And what did we do? And I'll tell you just one example with Stanford. We went to the local skating rink. That was the place where people were congregating and coming together. You know, that's not the first place you think about giving vaccines, but that was where the community was. And that's where we could create more equity in there. And so I think whether we're talking about our climate and sustainability and the things, let's ask those communities what they need and let's meet them on their own terms.
Yes, that's great. Okay, the next question from the audience. Reaching net zero healthcare emissions will require massive investment, research and development to get to sustainable practice, especially for the 70 to 80% of emissions that are from supply chain. How are you thinking about how do you think about dedicating resources to address this?
I don't mind. I answered it a little bit, and I didn't realize we were going to do all the questions at the end, so my bad. I answered a couple of them on my own just to stay engaged while people were talking. I'm a multitasker. But I think the key here is to use the power of our organizations. And, the 10 or 11 UC campuses, right? We've got 500,000 students and employees and millions of patients and tens of billions of dollars, and we buy a lot of stuff. So the answer is we have to utilize the power of those purchases writ large to get what we want from our suppliers, because it's very true that there's a lot, even though we do the best job that we can do, everybody's producing stuff in a way that doesn't make sense. I think we've done this at the food level, but we can do this in many other areas. And for instance, medical packaging, right? We could set new standards. Stanford, UCSF, and UC Davis, and just all the academic centers in California could get together, smart people, and say, how can we uniformly reduce this, change our approach? Not everything needs to be packaged for perfect sterility in every, it's different being in the OR than, being in an outpatient clinic. It's like, we don't maintain sterility in every single room, every single second. We need to really rethink what we've been doing. And I think we can do that together. I think that's why it's so great to have a symposium like this.
Great answer, thanks.
I'd also add to that, and David, that's a great comment, but think about what we've lived through with COVID. I have to say, around the country in supply chain, I mean, when we couldn't get masks, we couldn't get gloves, we couldn't get the laundry done at the high temperatures that we had always hoped for, and thought, what will this do to our sterilization, to our infection rates, et cetera? We haven't seen a change in that. And in fact, what we've proven is that, in fact, we can reuse items, which traditionally, and I'll tell you, the OR is probably, that's really tough to think about anything reusable in the OR. That's just, heresy, quite frankly. And so, but we've shown that that can actually be done. And I can tell you, our suppliers aren't going to be the first to the table to say, hey, reuse items, they're going to be selling less. And so I think we've got to take that, and back to the question about partnership, our ability to partner across academics, show the data, show that actually we can make a difference, and show to our faculty that in fact, you're right, you can reuse it and it's not going to cause harm. But I think we've got to show that across organizations to get that buy-in. And we're going to have to drive a lot of that, because I think sometimes it's going to be reluctant for our suppliers to do that for us.
They're diametrically opposed, as you've said. Their economic interests are not there, but I think we can move them. We're large enough, we can move them to do the right thing.
The next question, how important is waste reduction and landfill-bound waste diversion? How do you make the case at your level to institute measures across your organizations? What, in your opinion, is the biggest challenge that you would like seen solved in terms of waste?
Well, I don't know what would be the biggest in terms of quantification, but I think we've touched on several areas. I mean, packaging, we've talked about reusing supplies. We've talked about, David's talked about the food reusage. I think all of those things come into play. Building sophisticated equipment that has longer life than we currently do and have to exchange out sophisticated equipment on a regular basis, and it's got nowhere to go except for landfill, I think is another area of focus. So I don't think it's one single big thing that is going to change the waste issue. It's a mindset change so that multiple seemingly little things will ultimately add up to a big impact.
What else? We've got it. Oh, so
Go right ahead, David.
Okay, we've got to start with what's our goal. To some extent, what gets measured gets done, and quite frankly, I don't know that we're always measuring what that is, or we haven't made it a priority. And so, as Sam just reiterated several of the ways to do that, unless we as an organization mindfully set some goals, some direction around that. And I can tell you, this whole ability to talk about sustainability has created a different conversation internally in our organization, and probably lots of organizations, about what can be done, and creates a focus. And its teams can come forward with so many different ideas around how we do that. And I think oftentimes we as leaders think, oh, we've got to solve the problem. But if we throw it back to our team so many times, they can come up with some superior ideas to what we have. And just creating that focus around it is going to be our first start in many cases.
I was only going to add an idea that was just presented to one of the counties here in the East. They talk about the amount of waste of food substances that we waste when you don't eat. So they are now putting little containers in the recyclable bins that you would have just for your food stuff. And that food stuff will then be turned into energy. And so never thought about that. We just trash that food that we don't eat. But the industry could be quite large. And this is one smaller county in the metropolitan area. But I'm thinking if that grows to other counties, and it's a small package that, again, is recyclable after you've put the food that you're throwing away there.
Great. Okay, I think I have time for one more question. Resources. What funding do you plan to put forth in the coming year to address the health equity challenges brought about by climate change? Are you planning on funding specific initiatives at your institution?
I'll just spend 2 seconds. Climate Change Institute across our entire organization, veterinary medicine, environmental sciences, agriculture, pets, of course, and health, and the impact, especially around wildfires, on all of that right now. So I'll stop there, but we've got a lot of investments going on in that area.
Well, the National Medical Association is investing in the development of climate and health fellows, so that we are getting our younger physicians to really focus on this and starting in various areas, and hopefully they will go out and become greater ambassadors to bring about sustainable changes in terms of the environmental injustices.
Yeah, and like David, we've created, as academic institutions like to do, we've created new institutes on climate and health equity. But on the ground, beyond climate, UCSF has really identified health equity more broadly as probably the grand challenge of our generation. And we are responsible for it. We need to be held accountable for it. So for instance, within the UC system, I as Chancellor am the governing body of our health system. And so when I see our monthly quality and safety dashboard, the key parameters that we look at are broken out by race and socioeconomics, like English as first language. So I can see whether we're controlling diabetes effectively in all the populations that we serve, or are there inequities? And if so, hold the teams accountable for reducing those equities. As David Entwistle said, what you don't measure is really important. And so what you do measure is a measure of your values in many ways. So health equity truly is the grand challenge of our generation. Climate change is just one of the one of the drivers of inequity. But we have to, as an enterprise or an institution across the country and around the world, measure and then hold ourselves accountability to reducing those inequities.
Just to add one other point that we haven't spoken about, I think the workforce is also an area that we have to address when we're talking about this. So the diversity, inclusion, and equity in that workforce is going to be critical. I know everyone is coming in with DEIs, and it's a great title, and you're sort of putting people there, but you have to get the right person. And again, we need to look at the workforce and the impact that the people that you hire in those areas, not someone to window dress with the title, but someone that's actively going to be engaged in bringing about equity in the system.
Good idea. That plays into a position description for hiring someone like that. Thank you. Any other comments? Well, Angela, I see you're on. Thank you, panelists. It was wonderful to meet you and have a conversation. Thank you so much for your comments.
Thank you, Teresa.
Thank you, Teresa, for the wonderful session. I think we learned a lot, and we are all buzzing with ideas, and we are all able to leave today with a renewed sense of activity in climate change and health, and thinking about what every one of us can do. I heard a very nice quote today. I don't know who it originated from, maybe Emily Dickinson, that hope, although it's a gift that keeps giving, but it needs to be fed. And I think our symposium is something that would fuel this hope and hopefully the energy that would be able to bring the change. So I'd like to thank all the organizers. It was a huge production to put this symposium together, and our speakers and panelists and all the participants for active participation. Please fill out the survey at this QR, and there is a tiny URL as well. And I would like you to save the dates. There is going to be a mini symposium in the winter of 2022 on climate health and equity. And UC Davis has volunteered to run next year's NorCal Symposium on climate health and equity. And we already have a date, September 23rd, 2022. I also would like to point out that if you would like to apply for CME credit, there is a web link on the website. And last but not least, I would like to thank to all our sponsors and donors who helped make this symposium happen. I want to invite you, all of you, to our happy hour arrangements. We have a number of Zoom links. Please feel free to bar hop, so to speak, and visit all of us. We also have university groups that organized happy hours, UCSF, Stanford, and UC Davis as well. And you can see the main link below there. So with this, I would like to close this symposium. Again, thank for everyone for the participation, and have a good weekend and a good year, everybody.
Thank you so much.